Hi class.
Hello.
I'm here with my physical therapist, Sarah. Who are you?
I am a doctor of physical therapy. My name is Sarah J. And I'm going to answer some questions that JJ has.
Sure. So, tell us, I might at this point have already gone a little bit of detail with the class, but can you tell us what the talocrural joint is and what it does?
Okay. So here we have an ankle model, and the talocrural joint is made up of the fibula bone, the tibia bone, and the talus. And it's actually three bones that articulate to do dorsiflexion, which is this direction, and plantar flexion, which is this direction.
Cool. So that's kind of important, dorsiflexion and plantar flexion, because without that you can't walk or squat or lunge or basically move with your feet appropriately. So this little joint is seemingly pretty important.
Yes.
Okay. What are the most common injuries that you see to this joint, including mine?
A lot of people who have sprained their ankles or rolled their ankles have restrictions at the talocrural joint, which means that they don't have enough dorsiflexion, which is this direction. And that limits people's ability to squat. Sometimes you see people at the gym with their heels elevated or Olympic lifting shoes have like a slight heel lift to accommodate for that lack of range of motion.
Excellent. So what are some of the things, rather than cheating and wearing cheating shoes, what are some of the ways that you, like with me, can treat a jammed up talocrural joint so that you can squat safely?
Things that you could do is a joint mobilization. So where you would stabilize the talus, and then you'll ask the patient or client to move their fibula and tibia forwards, so then you're creating more space within the talocrural joint.
Cool. And I will show you guys that in a minute. And then what else?
Some soft tissue work you can do is, so your calves will be here, would be to increase the flexibility of the calf either by soft tissue mobilization or stretches.
And then the last thing we'll show is E-stim. Can you talk a little bit about what that does and why that can help?
Sure. So electrical stimulation, or E-stim for short, is a way to modulate pain. So your joint, if it's in pain, is sending signals to your brain saying, I'm in pain, I'm in pain. So what the electrical stimulation does, it kind of distracts that pain signal to the brain to help reduce the perception of pain. And it helps bring blood flow to the area, brings good healing cells to the area.
Sounds very much like massage. Excellent, thank you.
You're welcome.